Hello, thank you for the kind introduction. So I'm Valentin Prevost. I'm clinical scientist working for Canon Medical System headquarters. And before starting, I would like to share with you a quick overview of how Canon Medical manages its MR clinical and research collaborations around the world. So, firstly, Canon Medical MRI has several research centers in charge of its R&D. Some of them are based in Asia, like in Japan, where it is located the headquarters, but also in China. And several centers are in Europe, in France, Switzerland, UK, and other in US, like in Cleveland and Chicago. In addition, we are collaborating closely with prestigious university hospitals or research centers. The list is not exhaustive, but you can recognize UCSD, STEM Mac Clinic, the Rothschild Foundation, Kyoto University, Johns Hopkins. We are also working closely with sports clubs like the Football Club of Barcelona and Real Madrid. And recently, we established an important partnership with Cleveland Clinic with joint research projects focused on cardiology, neurology, and musculoskeletal medicine. Here, a map of our main key opinion leaders using our MRI systems and regularly sharing their experience during international events. Two of them are speaking today, Dr. Purcell from the Rothschild Foundation and Dr. Metro from the Football Club Barcelona. To support these collaborations, we have a strong team of scientists established in several countries. So I'm part of this team and I'm in charge of supporting collaboration in Europe. The strategy of our group is to promote science, education, increasing the number of publications, education material, and facilitating the research projects with our collaborators. Let's close this parenthesis and go back to the main subject of this presentation, which is artificial intelligence solutions in MRI applied for denoising and super resolution. Artificial intelligence is everywhere and opens an infinity of perspectives in medicine. The main goal of AI are to better detect symptoms, accumulating a big amount of data with sensors like smartphone or even connected watches, to predict disease evolution, to help with the analysis of all this new information collected, and to propose personalized care for patients. As you know, medical imaging is generating a lot of information, and AI could help us with its processing. In medical imaging, AI could help radiologists proposing tools to improve image quality, automatically segmenting regions of interest, optimizing imaging protocols, classifying pathologies, or predicting outcomes like disease evolution. Deep learning reconstruction solutions are in line with the first category, image improvement. To discuss image improvement in MR, let's come back once again to the main challenge that we are all facing, that is signal-to-noise ratio. Every day, a part of our job is to find the best balance between SNR and resolution. A good resolution means be able to clearly discriminate structures that are really existing. When resolution is increased, the quantity of signal per voxel is decreased, and it's the same story when the scan time is reduced. Having less signal means having more space for noise, which can hide critical information and then introduce some doubts in the diagnosis. The common consequence of this is the prolongation of the scan times that is negatively affecting patient care and productivity. Let's focus 1 minute on the noise. What is exactly? So it could be defined as the parasite degradation that the image is suffering from. And it's critical to know that the signal is random and always present in nature. When you detect too much noise, your eye is not able to distinguish edges, and then different tissues look like similar. And this is the reason why it's important to have a high SNR, but the question is how to increase it. So first, we can improve the signal. So to improve the signal, you can improve the detection sensitivity by increasing the magnetic field, for example, of 3T, 7T, by improving the coil with more channels, or by optimizing MR sequences. Another way to improve the signal is to accumulate signal several times and to average it We speak about NAQ for number of acquisition. But because the noise is random, average signal in one location will increase faster than noise, and this solution is very robust, but at the cost of an increased scan time. The second way to increase the SNR is to reduce the noise, and this by improving MR imperfection like B0 and B1 in homogeneities, by reducing the physiological noise generated by devices like respiratory motion, and finally by using signal processing tools which help you to reduce the noise without affecting the signal as possible. And this is what we will discuss. So inspired by the architecture of the human brain, deep convolutional neural network is a system that is capable to both learn by itself and then to perform complex tasks based on this training. The Canon Medical solutions called AICE or ACE has been trained to selectively remove the image noise without touching the signal. As you can imagine, the training step for this solution was a major point, and it's interesting to have a look on it. So I'm going to detail a bit this training process. So to perform this training, it has been used as ground through a huge quantity of MR images with a very high resolution and SNR, so around 10 NAQ. And these images were from different magnetic fields, different organs, different contrast, and all of them were mixed with a Gaussian noise and then were processed by a neural network, which has been built in such a way that the noise is automatically detected, and the system proposed a denoising solution, and the results with low noise is compared to the native image, and if the images were different, the network learned, adjusting the algorithm weight, and the denoising process is repeated. When the denoise image and the ground truth were considered similar, algorithm weights are saved, and the train algorithm were complete. So while the training procedure itself is time-consuming, a solution is now a very fast and efficient tool because it applies its pre-existing knowledge based on the training. And when a radiologist obtains a noisy image, denoising occurs in the image domain where only the high-frequency content is spaced through the network. The noise level is automatically evaluated, and denoising occurs without requiring any user interaction. After denoising, the low-frequency components containing the contrast information have remained in touch and are combined with the optimized results in order to maintain native contrast. The user has access to different options to set the optimal denoising based on his expectations, so denoising strength, image sharpness, and edge enhancement. All these denoising procedures can be done and repeated retrospectively when the patient is out of the system, for example, as long as raw data are still available. So since the introduction of ACE, the typical relationship between SNR and scan time have been redefined. This is an illustration to represent this relationship. So as we discussed, more you increase your scan time and more SNR you can get. So you can now split this in two categories: when SNR is too low and when it's high enough to be clinically relevant. As an example, these are two images from 1 NAQ and 10 NAQ. The first one is too noisy to be clinically accepted, and the second one has a scan time way too long. With ACE, this relationship is now totally different, and we can get images with comparable image qualities and the 10 NAQ acquisition for a scan time of 1 NAQ only. These striking results change the way that we think about MRI, and ultra high resolution is now accessible for clinical usage without sacrificing SNR or workflow. Let's have a look now on images coming from the field. So here you can appreciate a 2D FSE scan with an interpolated resolution of 200 microns in the plane, and denoising lead to a spectacular result. With such a tool, you can now access with high confidence structures like hippocampus that were not accessible before, or with noise. And it's not only for neuro. All body parts are compatible with this product. So here an example for the hip. Another example for cartilage with 100 microns resolution in the plane. And finally, you could even think of getting a 3T image quality with a simple 1.5T system. And because HACE has been trained to selectively remove the noise, you will not remove other information. So a metallic artifact caused by a prosthesis will give you the same artifact, for example. And this is good news because it's exactly what we expect from a denoising solution, to remove the noise and only the noise. So how we can trust this kind of tool? So an easy way would be just to do the difference between the native and the denoise images. And then you will get only what has been removed by the filter. So here it's an example with and without ACE, and what you can get with the resolution is with the subtraction is just noise. So the basic signal value and contrast are secure and not affected by the denoising. But the same subtraction with a different post-processing tool, like a smoothing filter, would lead to this kind of results. So you can see that some information is found in the subtraction, meaning that the smoothing leads to a loss of consistent information linked to real structures. Here you can see pretty well some edges and on the subtracted image. Oh, here. Yeah. So to conclude with this introduction, ACE is a new solution proposing a robust denoising that occurs only on the high frequency of your data, securing the native contrast of your images. This post-processing can be done retrospectively, and to be optimal, protocols need to be optimized in order to get noise. So, in fact, if the SNR is good enough before denoising, ACE will not improve the image quality. But as you know, it's not difficult to find scenarios leading to noise images. In fact, there are different approaches to make benefit of this tool, and I'm going to present you in the second part of this presentation, different approaches with some result of my collaborators who are working daily with ACE in their clinical and research activity. So part of them are using it to increase the resolution of their protocol. And here you can see ultra high resolution results and protocols that are accessible with routine scan time. As you can appreciate here on the 3T data on volunteers, by using protocol built especially for ACE leading to high resolution images associated with a strong noise, you can generate high SNR denoise images with an interpolate pixel size of around 100 or 200 micrometer, slice thickness of 1.5 millimeter, and scan time less than 6 minutes. Without ACE, getting this resolution would request an increased scan time to a point that is no longer considered clinically feasible. In this study, Professor Todias from Bordeaux in France focused on cerebral nervous system changes in obese patients within the hypothalamus. And for this, he's using a 3D MPRH sequence with 0.5 millimeter isotropic combined with ACE denoising. Same method has been used by Dr. Yamamoto, also working in Bordeaux, working on multiple sclerosis and comparing early and progressive stages of the disease. In this study, using 0.5 millimeter isotropic protocol, is evaluating the efficiency of treatment for MS. And finally, in this paper, Dr. Fukutomi visualized the inner ear anatomy in volunteers and in patients with menial disease. Such a high resolution image was only possible because of the use of ACE. Other collaborators would prefer to use the SNR gain allowed by the use of ACE by accelerating the scan time. And indeed, you can use ACE to combine decreased scan time while keeping a high resolution imaging. So in this protocol, all scans are 2 minutes long or less. And the routine knee can be now completed in under than 8 minutes, while without ACE, the average of routine knee scan is today around 15-20 minutes long. And with the same idea, Professor Doucet proposed a standardized 6 minutes protocol for routine brain MR exploration with only 3D acquisition and high SNR. This whole brain 3D exploration with this scan time is only possible because he is using ACE with all his scan. For multiple sclerosis, Dr. Yamamoto also found a way to accelerate the FLAIR imaging, widely used for the disease diagnostic and follow-up. And his goal was to allow 3D coverage with 1 millimeter isotropic in less than 2 minutes 30 seconds without decreasing diagnostic capability. And finally, in Cruz-Blanca Clinic in Spain, Dr. Alomar is using ACE to perform both ultra-high resolution imaging with 100 micrometers of resolution while maintaining a fast scan time. To accelerate even more, he combined ACE with compressed speeder, which is the compressed sensing solution proposed by Canon. And he performed this kind of protocol with all his patients. You can see here typical sagittal proton density FATSAT images of a patient with an external meniscus degenerative tear. And as you understood, ACE can be also used to save precious scan time. And these protocols have been used not only for increased productivity, but also for providing improved care to specific patient segments, such as children or the elderly. And for these patients, faster scan time might be the only way to obtain diagnostic results. Finally, it was crucial for us to propose a solution that we could trust and that would keep the quantitative aspect of the MR sequences. So it has been studied by our collaborator, Dr. Pouliken in Paris, who studied patients with supratentorial brain tumor by performing quantitative imaging such as T1 mapping, T2 mapping, mean diffusivity, and fraction of anisotropy. His conclusion is clear. ACE applied to fast quantitative MR sequences provided consistent mean values of metrics while reducing standard deviation. Here you can see a 60-year-old male with an occipital parietal high-grade glioma, and T1 map, T2 map, MD, and FA are reconstructed from 1 NAQ, 1 NAQ plus ACE, and 3 NAQs. Metrics were similar between 1 NAQ plus ACE and 3 NAQs, while scan time was reduced by a factor of 3. So let me now present another technology called PIC for MR. PIC is for precise IQ engine, and which has been developed to increase the image sharpness. PIC is a complex pipeline combining two unique steps, one for denoising in the blue cycle and one for matrix upsampling in the red cycle. So the role of the denoising step is to increase SNR. To do this, an AI-based algorithm similar to the one just explained before used in the ACE product is applied to selectively remove the noise without affecting the signal. The denoise images are then converted into K-space to proceed to the upsampling step, where the image, Okay, so the denoise image are converted into K-space to proceed to the upsampling step, where the image matrix size is expanded by zero filling process. And in addition to increase the perceived sharpness, this high level of resolution expansion is known to create some ringing artifact, or Gibbs ringing, around interfaces between structures. So, however, PIC incorporates a second AI-based algorithm which has been trained to detect and reduce this artifact. So here, a new example at 3T comparing conventional filter and PIC, and you can appreciate how PIC strongly improves SNR and structure delineation. A second brain example of a patient with MS disease. You can see that there are some lesions, and PIC can improve clinical confidence despite the low original SNR of these T2 weighted images. Excuse me. All right, okay. So let's have a look on the main question that we always hear from the field. Can PIC be applied to save scan time? The answer is yes. The SNR gain allowed by PIC can be used to accelerate scan time, reducing the NAQ or the acquiring matrix size while maintaining image quality. How does PIC denoised step works? PIC denoising is an AI-based method trained to identify and remove noise like ACE, but in both magnitude and phase component of the images, which is the key in certain contexts, like when you work with velocity information. Here's the K-space upsampling done by artificial intelligence. Excuse me. The answer is no. PIC uses two AI-based algorithms to denoise and to reduce the ringing artifact, but the matrix size increase step is done by zero filling, without using AI. And another question is, what's the purpose of the ringing reduction step? And as explained before, zero filling has some limitations. When higher upsampling factor are used, for example, a factor of 3, ringing artifacts can appear in areas with high contrast interfaces. Therefore, PIC includes a specific algorithm to detect and to reduce these artifacts. So to illustrate the power of this unringing algorithm, let's have a look on an axial T1 weighted reconstructed with zero filling by a factor of 3. When the unringing algorithm is off, you can see a strong ringing artifacts appearing in the surrounding of the brain. And when the algorithm is on, most of these artifacts have been detected and removed without affecting the real signal coming from the structures. A similar example on a T2 weighted scan without and with the application of the unringing algorithm. So to summarize, PIC is the latest Canon technology using artificial intelligence, which has been developed to increase the image sharpness. It can be set as an automatic processing, or it can be also used to perform additional and retrospective reconstructions as long as the raw data are still available. So to conclude with the whole presentation, so AI is everywhere in medical imaging. It's a very hot topic. With the introduction of ACE and PIC in MRI, Canon has taken the first step towards solving one of the biggest challenges that are SNR and sharpness improvement. These two solutions are currently used in the daily practice by our customers and collaborators that are performing high-resolution explorations, fast protocol, quantitative imaging. And in accordance with the Canon Medical philosophy, made for life, the goal for the adoption of this AI in MRI is clear: enhance patient comfort, expand diagnostic capabilities, enrich radiologist confidence, and increase the throughput. So if you are interested by more educational content, feel free to join our community in social media or to connect on the global website, and you will find a lot of educational material explaining how our solutions are working. And thank you for your attention.